સેવા સમાજ અને મણિબેન શિવજી દેવજી કન્યા કેળવણી ફંડ, they do lot of educational activity in terms of supporting college fee अथवा कोई पण छोकरे के स्पेशलाइजेशन कोर्स करनू है, इंजीनियरिंग आया मेडिकल जी जो को एंट्रेंस एग्जाम्स में थी अनला करने जो को स्पेशल कोर्स बहुत बारे जो इंटीग्रेटेड कोर्स ने मेरे करना था वेर फीस आर स्लाइटली हाई. इफ द राइट कैंडिडेट्स आर देयर वी कैन सपोर्ट देम इन टर्म्स ऑफ एजुकेशन. અને મીનવાઇલ આપણો જસ્ટ અવેરનેસ ક્રિએટ કઈ હતો કે સેવા સમાજ લાસ્ટ યર આપણો વડો પ્રોગ્રામ કેવે પાંજે કચ્છી સમાજ में सीईओ बनाने की कोशिश केवे. वी हैड इन्वाइटेड 100 स्टूडेंट्स and out of 100 students we selected 20 students on their merits અને એ 20 છોકરે કે પણ આઈઆઈટી મુંબઈ में 4 ડીજો કોર્સ કરાયો वो. This was a special course on a subject called how to become a CEO. The industry IIT professors અને દિલ્હીથી સ્પેશિયલાઇઝ CEOs જો આવ્યા हुआ 4 ડીજો કોર્સ वो અને they gave a training and believe me out of 60 students who had attended this seminar અને મજાનું આપણો બેચ वो લાસ્ટ ડે એ લોકો કોમ્પિટિશન રન किया हुआ કે थ्रो योर आइडियाज एंड देर वर रियल इन्वेस्टर जी शार्प टैंक है. शार्प टैंक में जी इन्वेस्टर्स वठावे એટલે લાસ્ટ ડે જો દેર વર 3 ઇન્વેસ્ટર હુ વર સિટિંગ ઇનસાઇડ ધ ઓડિટોરિયમ અને હરેક કે પણ જો પ્રેઝન્ટેશન ડને જો ઇન અ બેચ આઉટ ઓફ 7 બેચ ધ ફર્સ્ટ પ્રાઇઝ વોઝ વોન બાય નન અધર દેન કેવીઓ સેવા સમાજ એન્ડ ઇટ વોઝ અ વેરી પ્રાઉડ મોમેન્ટ ફોર અસ સેઇંગ દેટ કે પાંચે સમાજથી સીઓ બનેલા કરને એકડી સ્પેશિયલ અભિયાન હલાય में આવી है. અને ધ બેસ્ટ ટોપિક વોઝ जी સર क्या સ્ટાર્ટિંગ में કે એન્વાયરમેન્ટ તે આપણો બહુ વડો પ્રોજેક્ટ આખો એન્વાયરમેન્ટ ખરાબ થઈ રહ્યો હોય એ એન્વાયરમેન્ટ કે સુધારેલા કરને સેવા એટલે આપણો જો બેચ वो કેવીઓ સેવા સમાજ જો એ લોકો આપણો વડો પ્રોજેક્ટ કહેવાય કે એન્વાયરમેન્ટ કે કી સુધારનું સૌથી વધુ એન્વાયરમેન્ટ ખરાબ થયો હતો બિકોઝ ઓફ ધ એર કન્ડિશન્સ અને એર કન્ડિશન કે રીફિલ કરે અને એને કઈ રીતે પાછો નેચરમાં ખણેચનું. there were 2 investors who were ready to invest 50 lakh rupees on the spot. In fact, there were three investors ये लोग offered ना and so lot of students had got benefited. I just connect रहा बोय संस्था साथे बोय संस्था स्पेशली मणिबेन शिवजी जो को गर्ल्स डेवलपमेंट ला आज्ञा करे रही है काम અને સેવા સમાજ કરી રહ્યો है. So we are very focused in education and I સંસ્થા સાથે કનેક્ટ થયો અને એડા જ રેગ્યુલર અસી પ્રોજેક્ટ કઈંદાર હું તા બોય સંસ્થા સાથે મળીને and we wish કે ભાઈ મળે જો કોઈ યંગસ્ટર્સ हैं they can take part and they can take this advantage of both the organizations.
Thank you Bimal bhai. How are you? How is the Josh? मुला मैंने ठंडा थेवे आयो. I think all the guys I think मैंने थके रहे आयो आड़ो की लगे तो because अना तो engineering भी अना डॉक्टर अना हाने अच्छे था आके पहला खादे जो करो से सखाई देना पो एंजिनियरिंग करो करे देना से सखाई देना हाणे वरी पाछो मांदा पोयो तो पो डॉक्टरे गया वने ने ओनियो धंधो कड़ी दे हले तो ऊ सखाईंदा. So one more session has to go. So before we go for the session we had a message from our managing trustee Dr. Ilaben Dedia because she is not been able to attend this program, so she has sent a small video message. So I will like my volunteer to please play that video message.
Mangal Abhinandan to each and every student, parents for attending this career seminar for 2 days. It's a great investment that you're making for yourself, for your own future for the next 30-40 years. Wishing you all the best for it. Just a small message that I would like to give each one. Today times have changed as far as education and career is concerned. So kindly keep this in mind that multi-skilling is important and multi-skilling is possible through multiple certificate courses, internships as and when possible, every vacation, every break, observations, internships, and also experiences in social work. You may join any of the KVO organizations, local or any of the main organizations. or anywhere else like a Rotaract or your college clubs. See to it that you're involved in NSS or any such social activities, because life skills have become more important. Networking has become more important. All that you do in the classroom is fine. Gone are the days when only that was enough. So try and work at yourself from holistically as much as you can. Wishing you all the best. Thank you.
This was Dr. Ila Dedia. She is working with Matrushi Manibai Shivji Devji Kanya Kirani Fund as well with KVO Seva Samaj, and a true educator who is guiding the students all the way since long time. Secondly, under both these institutes, we are conducting aptitude test and career counseling. I think most of all you are aware about aptitude test. How much registered? Nobody? हाथ ऊंचा क्या होता है दर्जे दर्जे ने खोला कहता you have to raise your hand like this, so anybody can count. So aptitude test is going on. We have kept under both this institute at the charge of rupees 500 rupees. Already 60-70 students have registered, and second advertise will be coming in the Patrika by day or tomorrow or day after. So if you want to go for it, then you can go it for it. And Matrushi Manibai Shivji Devji Kanya Kirani Fund, as Vinit Bhai stated, we are creating engineers, doctors and this, but our society is for entrepreneurs. So we are not going for the job. People come to us for the job. So for that purpose, we are going to conduct a factory visit on 7th of June. Please note the date. On the 7th of June, we are conducting a factory visit on Silvassa. We will be visiting 3 to 4 factories where you have a directly one-to-one discussion at the spot. You can see how the activities are going at the spot. So we want to create an entrepreneur. So those who are interested are requested to give your names at the table which has been kept over there. So only 40 to 45 students will be taking for factory visit on 7th of June. So those who are interested, they can give their names, and advertise will come in Patrika also. But if you want to register yourself now, you can do this. Thank you.
Good afternoon, everyone. Finished with the break? Good. So we now move to the medicine and paramedicine session. I would like to take the privilege to call Dr. Hani Savla. She is a consultant internal medicine. She has special interest in treating diabetes, thyroid, and infectious diseases. Her practice is in Wockhardt Hospital, Mumbai Center, and she is an active scientific committee member of Kutchi Medicos Association. So please welcome Dr. Hani Savla. She's going to lead this session.
Thank you so much. So I'm, as a person, a big fan of technology. So I really loved the last session of engineering. But one thing which I want to bring to all of your mind, as Vinit sir said, paisa hai, bahut paisa hai. But you remember the old saying, health is wealth, hai ki nahi? So the thing that needs to be there, to be present, is health. And we in the medical field actually take care of that health. So today we are going to talk about the various career options in the healthcare. Especially the clinical career options is what we'll be talking about. So as soon as जी आंजो जन्म थिए तो तेर हकड़ो डॉक्टर आन साथे चालू करे तो, right? As you come to life, you are brought to life, you're brought to this world with your mother. The doctor is partnered. The doctor brings you to the world, the gynecologist. At some or the other moment throughout your life, a doctor is holding your hand, taking care of your health right till the last breath. So a doctor's role is very important in life, and it will not actually get extincted very soon, because every human body is different. There are practical differences in the human body which should be practically addressed by a doctor who is qualified and experienced. And that is why medical field calls for a lot of learning, lot of experience. So one thing which we all should know, कि कोई पण प्रोफेशनल फील्ड है, कोई भी प्रोफेशनल फील्ड हो, उसमें लर्निंग एंड गेटिंग योरसेल्फ अपडेटेड इज़ वेरी इंपॉर्टेंट. अगर आप अपडेटेड नहीं हो तो आप कोई भी फील्ड में सर्वाइव नहीं कर सकते हो. सो कोई भी प्रोफेशनल फील्ड में जाने के लिए ज़रूरी है दैट you should be a voracious reader, you should be learner. So my advice today for all of you here is reading की habit डालो. If you are a good reader, you will definitely survive well in life. If you are good at reading books, you will definitely do well in life. So it is utmost important कि at least read 20 books in a year. This is less which I'm telling you, but make sure you read 20 books not related to your subject in a year. This will make you a better human, it will make you a better reader and will help you to survive in your professional field. Now talking about career in medicine, do you have a laser change? No, it's not there here. So this photo is showing Anandibai Joshi, who was the first female physician who had traveled abroad and had got a career in MD medicine. So she is the one who has actually paved the path for others. Yeah, thanks. So with taking Anandibai Joshi as a role model, we'll go ahead and talk about the career in medicine. So what is MBBS? MBBS stands for Bachelor of Medicine and Bachelor of Surgery. After your 12th standard, you have to get this degree primarily to become a doctor, and it is recognized by NMC, National Medical Commission. Duration of MBBS, as you all know, it is 5.5 years of learning because human body is so complicated. You need at least 4.5 years of learning of medicine, followed by 1 year of internship. And most of the colleges do pay during internship also. Then comes to the entrance exam that you give for MBBS. It's going to be NEET UG. I'm not going into details because my friends ahead are going to speak about this. So the key, people who will be partnering this session with me, I'll be calling them soon after I finish the presentation. Yeah. So the key skills which are required for this session is the strong memory, attention to each and every detail, empathy and communication skills. It is important to have good decision-making abilities, patience, physical stamina, and passion for learning and helping people. So this is about the field of medicine, and there are various options which are there. So to discuss this, we will have our panel members. I would like to call upon Nidhi Maru, who is going to speak about entrance examination. I would like to call about Ushmi Sangoi, who is going to speak about occupational therapy. Can you give me the list? Nahi hai. Please come. Dr. Seema Vora, who is a physiotherapist. She has come. Haan, Seema is here. And Parmi Gala, who is a clinical pharmacist. She also will be joining us soon. So these people are going to talk to us today about various different fields of medicine and what are the career options available in each field. So let's hear from the experts, and I would first like to call upon Nidhi Maru for the session, who will talk to us about the entrance examination. Nidhi Maru, slides can be played for Nidhi Maru. So Nidhi Maru, she's a student who is doing third year MBBS at St. GS Medical College and KM Hospital. She cleared her NEET in 2022. She had a score of 658, which is a wonderful score for an MBBS student. And to secure place at GS Medical College is a dream of everyone who wants to pursue medicine. She's a winner at Bindas Bowl competition held by KVO Seva Samaj 3 times. In her 10th standard, she had 98% in ICSE board, and in her 12th standard, she had 88% from state board. So over to you, Nidhi. Please guide us about the entrance examination of MBBS and how did you prepare for the same?
Thank you, ma'am, for the wonderful introduction. Good afternoon, everyone. Myself, Nidhi Maru, and I'll be talking about NEET. So NEET is National Entrance Cum Eligibility Test. It is given by all the students who want to pursue medicine, but it is also an entrance test which opens career fields in other for medical and paramedical. So the eligibility criteria for NEET is nationality, Indian nationals, NRIs, foreign nationals are all eligible. Minimum age for giving NEET is 17 years, but there is no age limit or upper age limit. The parents can dream rave ki hane muke MBBS karna hai. They are also eligible for giving NEET. Next is qualifying exam. So you have to pass class 12 with physics, chemistry and biology or biotechnology and English subject, English language, and minimum marks that for general category you should have 50% in PCB, and for OBC, ST, SC it's 40%, PWD it's 45%. By that you are eligible for giving NEET. All these are the courses that open up after NEET. So your NEET rank and your NEET score, according to that you'll get allotted seats in the following courses. I may have missed BPMT, that is paramedical technologies, but rest BDS, BAMS, BHMS, that's Ayurveda, dental, homeopathy, Unani medicine, veterinary science, physiotherapy, occupational therapy, nursing science, and also naturopathy. So all these fields, of course MBBS, all these fields open up through NEET UG. So the format of the exam, it is a written pen and paper exam, no online exam. The duration is of 3 hours. There are total 180 questions and there are 4 sections: physics, chemistry, biology. In biology there will be 2, that's botany and zoology. So this is the UG syllabus. So mostly we'll focus on, for NEET preparation, we focus on NCERT textbooks. The NEET exam doesn't go beyond. There is no high level physics and maths like in JEE. So mainly for syllabus purpose, we stick to NCERT textbooks. This is the weightage. So there is, out of 180 questions, 90 questions for physics, 90 for chemistry, 90 for botany, and 90 for zoology. There's negative marking and 4 marks per question, one negative score if you go wrong. So the seat matrix. Now a government medical college say has 100 seats. So out of 100 seats, 85% of seats are reserved through state quota. The rest 15% of seats are reserved through all India quota. And even in 85% of seats, I feel the Panjan category mein. So for open there are 20% of seats, EWS 8%, and SEB 9% of seats. So for preparation, you should have a study plan, allocate time for each subject, focus on the NCERT textbooks only. For biology, the NEET, they do not prepare questions out of the NCERT textbooks. They give regular mock tests, as even for JEE mains preparation, as the speaker before said, that regular mock test will make you sit through the time of exam, be focused, make your MCQ solving skills more stronger. So give regular mock tests, and revision is the key. If you don't revise, you don't retain. Next is understanding the level of competition. So last year's NEET, more than 2.4 million students had applied for the NEET exam. Out of that, MBBS seats in all over India are 100,000. In that, government-aided MBBS seats in Maharashtra are just 5,850. Usme bhi category lagega and everything. For open, there are barely any seats left. And applicant to seat ratio is 20:1. So the level of competition is very huge. Now, after you give NEET, there is counseling. So you can fill your counseling form through MCC, that is All India Quota Counseling, and state authorities. So there is state counseling. So after you give your NEET and your NEET results come up, so there is an All India rank that comes up, and then there is the state list that comes up which shows your state rank. So after that, you fill the forms for this. You put a priority list of colleges. Say GS comes at top in Maharashtra, suppose, or if you're giving through All India quota, then AIIMS Delhi and all the colleges, whichever you are choosing to apply and through your score you feel you'll get. So you put a priority list of colleges, upload your documents, the documents get verified, and then you get allotted a seat. This is the process post NEET. Now, major question which all of us at 10th standard have is NEET karna hai, pata hai, but which coaching institute? There are holders of lots of coaching institutes. We'll crack NEET, All India rank 2, 3, 720 on 720 from our coaching institute. So how to choose a coaching institute? So I am not from Mumbai. I haven't given NEET from Mumbai, but in Mumbai I feel you should consider travel time. So if your coaching institute is way away and you have 2 hours of time of commute to go and come back from your coaching institute, you will be drained when you come home and you won't have time for self-study, which is very important for cracking any competitive exam, let alone NEET. So minimize commute time for more study time, self-study time that you can get. See the success history of the institute for the past 5 years, how they have come up, how the students there have fared. Experienced faculty, if they are available at that institute, with a qualified track record, if you understand how they learn, you ask the students who have been in the institute before and if the teachers are good enough, and study material and mock test which they go through. So all these criteria you should see which fits you the best, and then choose a coaching institute. See, every institute might show up a good result, like LN, Akash, whoever you see, there is a good institute. They show up good results. But the point is that out of the institute, in the institute, there may be 1,000 students, and rank holders may be max to max 10 or 15. So their success rate out of 1,000, only 10 or 15 if they get into MBBS seats. So that shows that it is mainly students on which your result depends. So you are the one who will make sure that you get a good result. So even if your coaching and study material and teachers matter, it is just 20%. 80% of your NEET preparation is through self-study. How much dedication you show towards the exam, how much dedication you show towards the subject, to yourself, self-discipline. So that is the major thing. So self-study about everything. And that's it. Thank you. Any questions?
So, Nidhi is going to be there for the post-lunch session, meet the professionals. But Nidhi, before you sit, I wanted to ask you and want you to highlight this point very importantly, that how many times while preparing for the NEET, you felt that you are not going to make through, and how did you recover from that? If you could just say one line. Because how many of you want to be doctors here? Very few. Yeah, so number of definitely doctors in the community has been decreasing, but believe me, it is not that tough field if you are dedicated enough and you know how to handle it. I'm sure, Nidhi, there's no one who is into medical field in your family, right? Your parents are not into medical field. Even I come from a completely different family, business family. There is no one before me or after me who has been a doctor. And I believe in one thing, that is you need to have passion to become the doctor. If you do not have passion, you do not have perseverance, you cannot do it. And if you have both of these things, nothing can stop you from being a good doctor. So don't think it is difficult. Any one of you, even if you have slightest doubt, speak to Nidhi in the post-lunch session and go ahead and prepare for NEET. Please tell, how did you recover from your tensions?
I used to cry a lot even at the last, because once the mock test start, your starting score is 400, 450s, and you have to, even to get a medical seat, your score in MBBS should be above 650. So I used to cry a lot, but then I had seniors, I had my family who used to be very supportive, ki, believe in yourself, it will happen. And I never stopped studying. Even if I had given hope, I used to never stop. I was consistent in giving tests, and slowly everything fell into place.
Great, great. So the thing is, self-discipline and self-study is very important in whichever field you want to go ahead. Thank you, Nidhi. Now I call upon the next speaker for session, Parmi Dedia Gala. Parmi is a very good friend who brings 13 years of rich experience in hospital, pharmacy and clinical operation. She currently leads clinical and pharmacy operations and business development for Tata 1mg in Mumbai. It's a very esteemed position. She's managing partnerships with hospitals like Tata Memorial and even Tata Trust Animal Hospital. Her career spans leading healthcare institutions like Saifi, Wokhard, Hinduja, HN Reliance. She's even a NABH assessor and also assesses JCI standards. So these are quality standards required for hospitals today. She's recognized with the prestigious awards in the innovation category in 2016 for her exemplary work in the field of medication management. So let's hear from Parmi about clinical pharmacy and how it has evolved as a career option today. Yeah, and of course, she is daughter of our mentor to all of us, Dr. Ila Dedia.
Thank you, Hani, for that wonderful introduction. Jai Jinendra, good afternoon to one and all. So I don't know how many of you all understand what is pharmacy. It is not restricted to what you all see, like a local chemist that is there or an online pharmacy. Pharmacy is a huge field which probably even I wouldn't know, now since I'm there since past so many years, I can relate to it. From the time the medicine comes, it is researched, it comes into the market, it is packaged, there are quality checks, then it is marketed, it is supplied, then there are stocks maintained, then there is post-marketing surveys that happen. So this entire journey of a single medicine is the process of pharmacy, and every single step over here is a different career to itself. It's a huge, lot of opportunities. It depends on what is your interest. So like I mentioned, it is a healthcare profession focused on medicines. They ensure the safe and effective use of medication. And when a medicine is discovered, that it's developed, packaged, it's marketed. All these are the different fields that one can branch out into. To enter pharmacy, after you give in your 12th standard and your CET NEET, you can either enter through PCM or PCB. It gives both the options open. So after 12th, when you give your entrance exams, you can get into a pharmacy college, which is of 4 years. So graduation is of 4 years. There is also a diploma available, which is of 2 years. And post your diploma, if you want to enter through the graduation, you can join in the second year of graduation. There are few colleges which also offer a 5-year program, which is a pharma MBA, like a combined program. Once you finish your 4 years of graduation, you have multiple options. If you want to do your masters in India, then 2 years. If you want to go abroad, again another 2 years. There are a lot of short-term courses which are for 6 months, 1 year, etc., depending on your interest. So like I was saying that each the word that I mentioned is a different thing. I just wanted to share my journey from how I have progressed, or what has been my journey, so that you'll understand what are the different opportunities. So when I started initially, I did my master's in clinical pharmacy. To begin with, pharmacy was not my choice. Like any other student, I also wanted to get into medical. I was getting my admissions outside Bombay, and at that point of time, I was not willing to travel post my 12th. That's how and I had a senior who was doing clinical pharmacy. My interest main was to interact with the patients. Anything that I wanted to do in life was having a close contact with the patients, and that's how I took I took pharmacy. After 4 years, I did my master's in clinical pharmacy. I entered Saifi Hospital as a clinical pharmacist. It was a very new concept. Basically rounding with the doctors, understanding what is the treatment that is going on to the patient, ensuring that the dose is correct. If the patient is having any kidney or any liver damage, to modify the treatment that is there, identify the drug interactions. I would give training to the nursing, the junior doctors, the pharma. This is how I started. I did that at Saifi, at Wokhard. Then eventually I also took up supply chain. I entered supply chain. So I started overlooking the pharmacy operations, the operation theatre pharmacy, the IVF pharmacy. So there are different supply chain, implants, etc. Then I developed interest. A lot of hospitals these days have integration. So IT integration, like Vinitha mentioned, that a lot of technology is coming even into in healthcare. So trying to develop a software for the hospital wherein everything can be automized. So the doctors, what records, the tests that they advise, whatever their records are, which are handwritten, which were handwritten, most of the hospitals now have an ERP system. So they are all integrated into the system. Now, say for example, if a patient is having asthma, and if the patient has been taking beta blocker or somebody has prescribed beta blocker, the system would give an alert that this is a contraindication and you cannot prescribe. So this is all that needed to be developed in a way that fitted in the hospital system. So I gradually entered into IT. Along with this, I continued doing, because clinical was my passion. I still continue doing that, but that's how I entered into IT. Then when I joined Tata 1mg, it's an e-commerce platform. Besides e-commerce, it has a lot of other verticals, and that's how I moved into business development. So whatever modules we have, I kind of meet in clients, I pitch into hospitals, to other healthcare companies, to other IT companies, corporate wellness companies, and now I like I said, I enjoy clinical, so I maintained that. At the same time, I kept taking whatever opportunities I had. In my career, I realized that probably I wanted to do management, because now the position had increased, the responsibilities had increased. There were a lot of data analytics, a lot of other skills that I needed to upskill myself in. So I did a MBA while I was working. So the subjects typically that are there are part of the courses. Pharmaceutics is basically how you make all these medicines, be it tablets, capsules, even cosmetics for that matter. It's also a part of curriculum. Then pharmacology is exactly to know what exactly the medicine is, how, and cognosy is basically the medicine that you get from the plants. Chemistry, math, statistics, clinical pharmacy, anat and physiology are going to be the major subjects. So why choose pharmacy? It is really in demand in India as well as globally. It's a mix of science, healthcare, and at the same time, if you want to continue helping people, it's a great field. There are diverse paths. You can get into hospital research, industry startups. The skills that you need a strong science foundation. Your attention to detail should be there. You need communication skills, because day in and day out you will be talking and interacting with people. Problem solving skills, and empathy and ethics in this field are very important. One more thing that I want to include is that a lot of students who take in PCB, they are happy that math is no longer going to be a part of their syllabus now after 12th standard. So a lot of them are very happy about it. My sincere request is that continue pursuing your math. Do not dislike it, because whichever field you go, wherever you go, even in your daily life, math is something that is going to go a long way with you. So start loving the subject, how much ever you hate it now. Second thing is take up internships or shadow professionals to understand the real world challenges. So while I was doing my 4 years of graduation, like I said, my earlier plan was medicine. So for me, pharmacy was very new, and because it was so vast, I took up an internship every year, after like first year, second year, third year, fourth year, in different fields, for me to understand what I like and what I don't want to continue with. You should also get involved in opportunities, where you get to do social service or Rotaract. It builds you as a person, a lot of professional development, and how a person you come out to be. Real world exposure helps you find what excites you the most. The difference between ordinary and extraordinary is that little extra, because who you become outside shapes who you will become in your career. Because all of you all are going to get the same level of education, but that something extra what you put in is going to make you different than what everybody else. With that I end. Thank you.
Great words at the end, Pami, very inspiring. And her journey was also very inspiring, how she took one degree after the other and one position after the other. I think it's a real amazing thing for anyone to achieve along with kids after getting married. So I'm sure a lot of you will be seeing her as a role model. Now she said a very important thing, shadow the profession. એટલે અહીં હોન ફિલ્ડ में અકડે વને ને ને રહ્યો વર્ક કયો હોડા ને રહ્યો उधर जाके देखो कि आपको वो जम रहा है कि नहीं, whether you're having passion for it or not. And for this, for the students who are attending today, there is one thing which I can do is that you can shadow me at Wokhart Hospital and you can shadow me at my clinic, where we can actually show you that what medical field is, how does it work, and you will get an opportunity to get exposed to various specialities, even to various other paramedical fields also. Like we have radiology technicians, we have lab technicians, as well as we also have nurses working with us. So you can shadow each one of them for a week or for 2 to 3 days and understand whether you really like that field, whether that human touch actually is comforting to you, whether you like to interact with patients. This will actually make you, help you to make a good choice. Aptitude test is excellent, but second thing is to shadow the profession and you will know better whether you are made for it or not. So I have kept things open, and any one of you who also want to allow people to shadow you, please tell them, so that at least those who are interested can contact us personally and shadow us at our clinics. So with this, I would like to invite the next person, Dr. Seema Vora, who has been doing this session for many years. She is a Bachelor of Physiotherapy from KJ Somaya Hospital, Sion. She has done her diploma in rehab from All India Institute of Physical Medicine and Rehabilitation at Haji Ali, which is one of the best places in Mumbai and I think in India. She is a certified McKenzie therapist having expertise in evaluating, treating back and neck pain patients. She is the owner of Samyak Physiotherapy Clinic at Ville Parle, founder of Blooming Care, which is a holistic approach dedicated to women of all ages, which is, I think, a wonderful job, Seema. She has presented various seminars on self-management of back and knee problems, which I think is very important for the students today. You should at least give 3 tips to them because they have to study 14 long hours of day. So with this, I invite you, Dr. Seema, to take the session ahead.
Thank you, Dr. Hani, for such a wonderful introduction. First of all, I'm seeing you, all of you, like since more than 2 hours, we all are sitting here. Can we just get up from our place? Stretch our back. All of us. Stretch yourself back. No, we don't. We are into sitting work for so many, whether you are taking engineering or medical or any field, commerce or anything, we don't take care of our back, and which makes me feel bad that many of patients which I am getting are just because of their sitting profession. So just a little guidance to you that get up in between, stretch yourself, whether you are a student, whether you are a working professional or anything, give a little movement to the back, because at the end, movement is life.
And she will have 3 more exercises. Huh?
So, coming to physiotherapy, it's a fastest growing area of medicine. I would say it's a most important rehabilitative service needed in the community. We must have all experienced it, during the COVID or post-COVID time. So now to give you just idea ki what is physiotherapy. So physiotherapy involves evaluating, diagnosing and treating a range of diseases and disorders using physical means. When I say physical means, is by giving them exercise or using some electrophysiological modalities. We see patients, we treat them non-pharmacologically and non-surgically, just by giving some exercise and the movement, we can help the patient. It's a very rewarding profession. As Vineet sir must be there is money also, but the reward here is the personal satisfaction what you get. When you can cure somebody from pain, when you can make somebody independent in their daily routine, when you can make a person mobile, the joy on the patient face, what you get at the end of your session makes you forget everything. So the job of the physiotherapist is very challenging but profitable. There are certain personal attributes required. I believe these are common for all the medical field. First thing is ability to install confidence and courage to the patient. You know, you should have confidence in yourself so that you can give it to the patient what they can do it. A good physical stamina is needed. As a physiotherapist, we are many a times involved in lifting the patient, moving it from one position like sitting to standing or standing to walking. So a lot of physical stamina is needed. It's not only where you are sitting and prescribing medicine or evaluating and this. A lot of good physical stamina is needed. You should have patience and understanding of people, because the person who's coming to you is into a lot of discomfort and agony. So you should have that. A good observational power. I would say when the patient enters only, your evaluation starts there. So it's said that along with your observational skill and the knowledge of your anatomy, many a times we can diagnose the condition without patient undergoing unnecessary or costly investigation. You should have a good analytical and logical reasoning skill, a good scientific reasoning skill, and a problem solving skill. And at the end, you should be having excellent interpersonal and communication skill, because many a time physiotherapists work as a team with other medical faculty also. So you should be having good of that. So all these attributes together with the knowledge of human anatomy are in a making of successful physiotherapist. For all that, to become a successful, you should have an empathy with the patient, to understand their problem. Now, admission process, Nidhi has covered it. So, eligibility is 10+, so I'm not going much into detail of NET. Just to say, there are 670 colleges in India which are offering physiotherapy courses. But to narrow it down, in Maharashtra, there are 47 colleges. And further to narrow it down, there are only 11 government colleges. Just important here is, when you enter into government, I agree that Nidhi would be agreeing with me. The exposure what you get is vast, is huge. You cannot compare it what you get it in private. So when I did my master's from All India Institute, that actually made me understand what kind of variety of patient you can see and you can help them. It's a 4-year course which include comprehensive study about your anatomy, the physiology of body, the biomechanics involved with every joint and every movement, the understanding of the exercise therapy. We even use something called as electromodalities, like understanding of how the modalities are working and what they can offer it to reduce their pain. The fee structure of the government colleges varies from 27,000 to 75,000 per year, and in private colleges it goes up to 1.5 to 6 lakhs. Definitely our course does not end here. We can pursue even masters after doing your bachelor's of physiotherapy, which is a 2 years process, and the entrance is again here required is a PGCET. And fee structure ranges approx similar like bachelor courses. After doing this, you can specialize into orthopedic, neurology, where in orthopedic, we are seeing more of patients with joint pain, fracture or post-operative cases. In neurology, the patients which are having some neurological issues like stroke, paralysis, paraplegia, Parkinson's, all of these conditions have been seen. Geriatric definitely is the most a community service, I would say, is the most upcoming field, where we are even seeing elderly patient. And recently, like I said, a woman healthcare, where we are seeing a lot of patients with prenatal, before delivery, after delivery, getting them back to their routine is what a physiotherapist are doing. Sports is a upcoming field. If you are interested in sports physiotherapy, there is no limit to it. You can reach the sky is the limit, I would say. And a cardiorespiratory physiotherapist, where we are seeing a patient inside the hospital admitted in the ICU and giving them the exercises. Along with it, if you don't want to pursue your master's, I would definitely recommend to pursue your master's, but there are small certificate courses which also you can pursue it after doing your Bachelor of Physiotherapy, where you can specialize into aquatic therapy, a Pilates course, a McKenzie therapy, kinetic control. So all these are short courses, spending like, some months to some maximum 2-3 years, but which you can do it along with your work profession. There is vast career opportunity, I would say, in the physiotherapy, that you can work in the rehab or government hospital, where physiotherapists are seeing the patients and making them mobile and independent. As for the woman, I would say a private home visit and private health and wellness clinic is a good option where you can have a good work-life balance. You can work for a few hours and at the same time manage your home. We can work even in the school setup also, where many schools are taking physiotherapists to, and the occupational therapist definitely, for kids with special needs. We can work in the fitness centers where we are training athletes to get them muscle strengthening and getting them best into their sports. We are even career may we are in working in industrial workplaces. As I said, the ergonomics, like how even in the industry many people are sitting for a long time. So how they should take care of their health. And at the end, definitely you can enter into education and research. So this is just to give you a wide spectrum that physiotherapists are involved from a small child to an elderly individual. They are even involved from a minor conditions like a small back pain or neck pain to the most difficult, complicated conditions like cancer. And they are even seeing a normal individual, a healthy individual, to the most physical demanding profession like athletes. Thank you.
So Seema, as you promised, or as I took the promise from you, 3 exercises for the student while they are studying for long study hours. You can demonstrate pro bono.
First, already I have given. I want you all to break your work and do the backward bending. This I recommend to all of my patients, where you keep your hands at the back and stretch yourself as far as possible. The second one is you go on your toes, okay, and you stretch yourself where you go Tadasana. Many a times we are sitting, studying all this. And the third most important, which is needed for everybody, is take the chin in. Half of the day or more than that, we are into the screen with so much of forward head posture or so much of downward. And that's why I'm getting so much of neck and back patient. So keep your chin in. These 3 exercise, if you keep on doing, even if you are healthy, you won't have to see us. Thank you.
That's a loss.
One last exercise. इमका डॉक्टर चेवे आवा. Just एकड़ी सेकंड ला उभा थियो न मडे. Raise your hand. Raise your hand. Raise your hand. बरोबर है? And take it on the right side. અને બાજુવાળે કે ને 3 વખત થપથપાયો અને ચોયો કે કોંગ્રેચ્યુલેશન તું સવારથી નોન સ્ટોપ એનો વિધાઉટ મોબાઈલ તું વઠો અહીંયા સો આઈ એપ્રિશિએટ એન્ડ કોંગ્રેચ્યુલેટ યુ. થેન્ક યુ.
3 cheers. Great. Thank you, Dr. Seema. It was wonderful, and thank you so much for giving those pro bono exercises for our students. I'm sure they'll remember you every time they do this exercise. And with this, we have the last doctor, Dr. Ushmi Sangoi Dedia. She's an occupational therapist who has also graduated from the esteemed Seth GS Medical College and KM Hospital. She's currently pursuing MA in Psychology as distance learning. And she's working in Theracen's Pediatric Clinic, Ghatkopar, since last 3 years. So she's going to throw a light on a new, it's not new actually, but on a field of therapy which has actually climbed real good milestones today and has helped many of the autistic child to live a normal life. So over to you, Dr. Ushmi Sangoi.
Good afternoon, everyone. And sabne thapthapa liya. So this is the last session for the day. You have done good. After this, you can have lunch. I'll take few minutes of yours. I won't make it long. I'll just give you few examples and I will be done. So I'm here standing on stage for the first time, holding mic. Thanks for my mom to push me so hard. Thank you for the KVO Samaj to give me this opportunity to put forward this occupational therapy term, which most of them are not aware. Can anyone raise hand who knows or who has heard what occupational therapy is? Most of them, I'm glad. So yes, starting with my slide. Starting with occupational therapy. What is occupation? In our general term, occupation matlab something we are doing for our living, earning or something like that, our business. But to reach that living, what are the basic things that we do in our daily life? So occupation refers to everyday activities that we do as an individual to occupy ourselves, to do what we wish and what others expect us to do. So it includes that this involves activities of daily living, which we call as ADL. So this starts with when you wake up, getting up from the bed, brushing, grooming, toileting, mobility. Everything involves in this ADL. So now what occupational therapy does in this? A healthcare profession that helps people across the lifespan from pediatrics to geriatrics participate in meaningful activities through therapeutic use of everyday activities, focused on independence and quality of life. Now, everyone sitting here, some of the other has been hospitalized or our relatives are been hospitalized. It is so difficult for the patient to at least manage these routines for a week. 2 से 3 दिन एडमिट हुए तो भी कितना डिफिकल्ट होता है, ब्रश करना, नहाना, स्पंचिंग करना. हमारे रिलेटिव्स के लिए कितना डिफिकल्ट होता है वो सब कुछ मैनेज करना. नाउ जस्ट इमेजिन अ पर्सन विथ डिसेबिलिटी, परमानेंट डिसेबिलिटी, स्ट्रोक और एनी अदर कंडीशंस. दे आर डिपेंडेंट ऑन देयर प्राइमरी केयर गिवर कि वो उठेगा, वो रहेगा तब मैं उठ पाऊँगा, वो रहेगा तब मैं खा पाऊँगा, वो रहेगा तब मैं ब्रश कर पाऊँगा. So what occupational therapy does here is we make patient independent as much as possible. कि उसको होना चाहिए ना कि यार कोई नहीं है फिर भी मैं कर पा रहा हूँ. It is not like disability. So have you ever thought about a career where you help regain independence after an injury or illness? When I gave my NEET exam, I couldn't make it to MBBS because of my scores. So मैंने BHMS भी छोड़ दिया because of some reasons. Then I got into BOTH, occupational therapy at KM Hospital. I never knew what I was doing till my first and second year. I was regretting so much कि यार MBBS छोड़ दिया, डॉक्टर बनना था. BHMS छोड़ दिया, डॉक्टर बनना था. Then at my 3rd year, there was a patient at KM Hospital who was a relative to our staff and he was very rich, educated, well educated. At his early age, 30s, he had a bike accident where he got injured at neck and spine. He got quadriplegia. He was on wheelchair. No movements, and he had a business, his own business. He came to us with a case of depression. So when we assessed him, we got to know कि वो depression क्यों है उसके लिए. Because at this age, early married life, he had so many things that he couldn't do as a husband, as a son. So when we assessed him, we got to know that he's not going to his company anymore. He's just sitting idle at home. Why is he not going to company? Because wheelchair उठा के वहाँ पर कौन लेके जाएगा? वहाँ पर अगर पेपर वर्क है, who is going to do that paper work? उसका एक मोमेंट आया था लाइफ में where he was not able to sign because he didn't have strength in his hand to do that. He was about to give the thumb impression. And because of this, he went into depression. There were many reasons he went into depression. So what we did was, we gave him few assistive devices. We gave him few splints, I will talking that further, which made him independent. Ki at least thumb impression nahi and he could sign his papers. So that made him relieved ki chalo at least मैं कुछ कर पा रहा हूँ. Instead of sitting at home idle. So when he got that smile at his face after 1.5 months of training, when we were giving him, he said कि यार अभी तो at least I am feeling relieved. So when I saw that smile in his face, तब I realized कि doctors doesn't mean कि you have to give medicines and you can cure. You can do surgeries and you can cure anyone. But doctors also means कि you are rehabilitating someone. You are trying to make that person independent. तो अगर उसके वजह से भी किसी के सामने वाले फेस पे स्माइल आ रहा है तो आई एम हैप्पी विथ माई जॉब दैट आई एम डूइंग. तो इवन इफ यू गाइज हु आर थिंकिंग आफ्टर योर नीट एग्जाम्स और एनीथिंग कि अरे यार मैं MBBS में नहीं जा पा रहा हूँ, तो व्हाट आर द रियल डॉक्टर्स? तो रियल डॉक्टर्स मतलब ऐसा नहीं होता है कि तुम मेडिसिन देख के किसी को क्योर कर रहे हो. बट इफ आई एम वर्किंग इन अ पीडियाट्रिक सेटअप राइट नाउ, सो व्हेन द पेरेंट्स से मी कि my kid is doing this right now, they are emotional, they are smiling, so I get that achievement. That is an achievement for me कि मैं छोटे वाले बच्चे को मैं इतना milestones achieve करा रही हूँ. So I'm happy with that. So who do occupational therapists work with? As I said, it is lifespan from pediatric to geriatrics. We work with children with developmental delay, disabilities, autism, attention deficit, hyperactivity disorder. These terms are so common right now. Autism, the occurrence of autism is so much. The learning disability, ADHD, hyperactive. मेरा बच्चा स्कूल में नहीं बैठ रहा है, मस्ती कर रहा है, behavior problem. So we work with those children. Adults recovering from injuries and surgeries. Yes, physiotherapists play a role in getting the physical ability back, and along with that, we work how with that physical ability. जितना strength अभी उनमें है available, उस strength के साथ वो कौन सी चीज़ें easily कर सकते हैं कि उनको किसी और पे dependent रहने की ज़रूरत नहीं है. So we also work with elderly individuals needing help now. If there is an elderly individual who has a fear of fall, मतलब above the age of 65, 70, जिनको बहुत गिरने का डर है, high risk of fall. So what can we do with them? We do home modifications, कि आप घर पे कौन सी चीज़ें किधर किधर रख सकते हो कि उनको प्रॉब्लम ना हो गिरने का. And also with the external environment. We also work with dementia, Parkinson. Now dementia है, तो how are the dementia people going to work? How are they going to survive in the external environment? So we also work with them to make their daily task easy. People with mental health conditions, as I said, we do work with depression, schizophrenia, bipolar disorder, and many more conditions. We can work with hospitals, hospital setup. We do work in school. Now there are many international schools which have an SI setup. SI setup is sensory integration setup that autism, ADHD kids need. So we do work with schools. We collaborate with the counselors in the international school. We work with rehabilitation centers. We do take home visits if it is an adult patient. Mental health facilities, and we can also put forward the clinic, and we can do private practice. So yes, the thing I was talking about, कि he was not able to sign, he was giving his thumb impressions everywhere, and being an educated person, it is very depressive कि अभी मेरे को thumb impression देना पड़ रहा है. So the first image that you can see is the splint. We call this as a splint. So we made, this is not the original picture because the story is long back. So this is the splint. The white color part is that we make from a material which can hold pen or a pencil, anything. And with this, they have a mobility to put forward to improve their fine motor things, to hold pencil, to sign, to write, or to anything. The second picture is wearing dress. For example, if wearing pants, so the stick that he is using is called as dressing stick. There are various type of dressing sticks that we make or we recommend to patients depending upon the conditions and that they require. अगर कोई चीज़ नीचे गिर गई है and there is no one to help that person to take that up, so we also give them few equipments like that कि उनको झुकना ना पड़े and they can just take it like that. The third is a universal cuff, where they can eat independently. There is no need of someone feeding, but yes, for this obviously we required few strength, some amount of strength in their upper extremity or lower extremity. And this is the pediatric setup. What do OTs do? We do assess and provide the treatment plans, recommend adaptive devices that I showed you, the dressing sticks, modify environment or modify the routine, collaborate with other healthcare professionals. Now, the common thing that I have encountered while I was doing an occupational therapy course was that कि physiotherapy है, occupational therapy है, तो difference क्या है? एंड मैं तो एक बार एक्सप्लेन कर देती थी कि व्हाट इज़ एन ऑक्यूपेशनल थेरेपी. कोई मेरे पेरेंट्स को जाके पूछता आपकी बेटी क्या कर रही है, फिजियोथेरेपी जैसा ही कुछ कर रही है, एग्जैक्टली नहीं पता. नाउ आई एम श्योर दैट मेरी मम्मी को भी समझ में आएगा कि व्हाट एग्जैक्टली आई वाज डूइंग फॉर फ्यू ईयर्स. सो येस, इफ the physiotherapy and occupational therapy do work together, but our goals are different. If the physiotherapy goal is for the physical movement, we will be focusing on how do we improve their independency and quality of life with that physical strength. Key areas is strength, mobility, balance, pain relief. They will be using some modalities. If you have heard TENS, ultrasound, किसी ना किसी ने तो लिया ही होगा, तो दे यूज दैट. एंड व्हाट डू वी यूज एक्टिविटी बेस्ड ट्रेनिंग. जो आप घर पे कर रहे हो उसी के साथ हम आपको ट्रेन कराते हैं. Adaptive and the environment modification. They use treadmills, ultrasound. We use adaptive utensils like spoon, dressing, and all those things. They work with clinical hospital sports centers. We work with school and home settings. The goal of physiotherapy is to restore physical ability, and ours is the quality of life, independency in their daily life. So as I gave you this example I gave you earlier, so physiotherapy will help you move better, and occupational therapy will help you do your daily work easily. So education is 10+2 and NEET. Now in this, yes, obviously it is NEET, but the cutoff score, I have just recently searched about it. So the cutoff score is above 400 you need for a I don't know about the physiotherapist, but yes, for the occupational therapy, for the government colleges, above 400. Duration is 4 years of academic training, 6 months of internship. Masters it varies if you're doing it abroad. In India, out of Maharashtra it is 2 years. In Maharashtra it is 3 years. Subject is starting at 3 years, the subject is same as MBBS, and plus we have internal subjects, and the final year of occupational therapy is purely with OT related subjects. So you will be having some amount of knowledge that MBBS students have, but additionally we have in other subjects. The colleges is very limited amount of colleges we have for occupational therapy. It is just 4 government colleges in Maharashtra, and there is one private college, D.Y. Patil. So the first one is KM, the second one is Sion Hospital, Lokmanya Tilak Hospital. The third one is Topiwala National Medical College, Nair Hospital, and this one is at Nagpur, GMC, Government Medical College. D.Y. Patil. The fees for the government colleges varies from 50 to 60,000 this year, and D.Y. Patil starts from 3 lakh per year. The stipend, when you are doing an internship, stipend is available in government college. When you do masters, stipend is available in government college, but in private setup, you don't get stipend. So in D.Y. Patil also you won't get any stipend, and we have one more college in Bangalore, Manipal. We don't have stipend there also. So it is very important that you take admission in AOTA recognized college, because it is very important when you are pursuing your masters in abroad. So this recognized college is required, that is All India Occupational Therapy Association. So if you have any doubts, we can meet in afternoon, or else you can take my contact number. Thank you.
Great work, Dr. Ushmi. The best part is she's fasting today, and she has put all her energy into the session and given us great information about occupational therapy. So I should say great. And to the great mother who has encouraged her to be here, please, can I please have a... She works with our Dhanji Devsi Kanya Kilavni process. Matushri, okay. Matushri Maniben. Okay. Yeah, so here she is. So 3 claps for you also, ma'am, for encouraging her and bringing her to this stage. And also keeping the roots intact where she's still following her duty as a Jain and as well as doing her noble work back. So just talking about this, that various career options, we know that a doctor sits at a clinic, so this is one option which is available post any of these degrees. But as all of them have already told, there are other options also which you can choose after taking this clinical degree in medicine. So either you can do super specialty, as they have told, you can do masters, or you can even enter civil services. You can completely change your field and do a UPSC and get your career done in these government civil services. You can go into administration, do a MBA in healthcare, and you can be into 2 noble professions at a time when you become a teacher, a lecturer, a professor, or coach other students. You can enter into public health. It has got great demand abroad. And you can get into certain work from home like jobs also, like medical writing, journalism, medical journalism, which is also an upcoming field. And as Ashwin Bhai told, that we are entrepreneurs. So just to tell you, many health tech and many health startups have been brought about by doctors. So yes, you can be a doctor and you can still be an entrepreneur. You can start your own clinic, own hospital. You can start an health tech startup. So Food Darji, if you know, all of you know about Food Darji. It's an app which delivers healthy food at your doorstep. It has been started by a doctor from Nair Hospital. So of course, there is a chance to be an entrepreneur even after being a doctor. So you can actually touch various fields after being a doctor also, and you can be in this noble profession for all your life. Talking about monetary satisfaction, so I'm sure all of them will agree that there is job satisfaction, and of course the monetary appreciation is also the same. So Parmi would like to say, and I think all of us, all of those who have given the lecture should at least talk about the financial aspect right now. It's off.
So in the previous session, I was hearing a lot of
Paisa,
time
paisa.
कि पैसा पैसा पैसा. 3 Idiots का famous dialogue सबको याद है ना? Success के पीछे मत भागो, excellence पर focus करो. Excellence अगर होगा तो success झक मार के आएगा. So in whichever field you are, do not choose the field for the money that you're going to get at the end, because if you're good at what you're doing, irrespective of whichever field, you will do wonders. And I wanted to burst one more bubble of the kids over here. एक थोड़ा reality check. My parents used to tell me, खाली 10th में focus कर भणेगन पोइ तुझी life आखी set है. खाली ई 2 વર્ષ तू भणेगन. पोइ 12th આવ્યો. हाणे खाली 12th भणेगन पोइ अॻियां life तुझी set है. हाणे graduation. So this, see, let us understand, we are entering a professional field. It is not going to be easy. We are never going to have, that fun times what we had in school. We have good amount of work to be done in every stage of our career. Only difference is if you enjoy what you're doing, you will not feel the pain of doing or putting in so many hours. So today, after so many years, I am a mother of 2. I have good amount of, good professional life. At the same time, I have a good balance with my kids. I personally play pickleball cricket twice in a week. So I have a good balance. It's up to you how you, what are your priorities in life and where you want to put an end or where you want to start climbing now.
So don't ever think that medicine is a very long field or it is an end of life. You can have wonderful work-life balance provided you love what you do. And monetarily, it is absolutely satisfying. The appreciation is great. And the best thing is that it is a field where, the doctor population ratio is not met in our country at all. So the demand will always be high come in next 20 years also, in spite of all the technology growing hand in hand. Thank you so much, and I hope you have learned. We are available for the post-lunch session, and we have homeopathy doctors also, and Ayurveda doctors also who will be there for post-lunch session. We could not include everyone now, even dentists will be available. So if you want one-on-one interaction with them, they will be available for the post-lunch session. One more thing, those who are preparing for NEET UG, there are handwritten notes by a student who has scored really well. If you are interested, you can contact Mr. Vimal Vora. He has the contact number for the same. And all of us are available for any one of you who want to do some observership with us. So you can contact us one-on-one for this. Thank you so much, and thanks to all the ladies here who have adorned the session really well. Bye.
I think they deserve a big round of applause. All these speakers were superb, and I'm sure you all gained lot of knowledge. Requesting all these speakers to come ahead. Requesting IPP of KVO Seva Samaj, Dr. Manjula Ben Shah, Vice President Bimal Bhai Vora from KVO Seva Samaj, and our Education Committee convener, Mr. Nayan Nisar, to come on the stage to felicitate all the speakers. So first, Bimal Bhai is going to felicitate Dr. Hani Savla. Manjula Ben, Dr. Manjula Ben is going to felicitate Parmi Ben. Nayan is going to felicitate Dr. Seema Vora. Ashwin Bhai and Mitul from Matushri Manibhai, Manibhai Devji Shivji Kanya Kelavani Fund, to felicitate Dr. Nidhi Maru and Ushmi Sangoi. And for group photo, requesting all Shilpa Ben, Vice President of Manibhai Kanya Kelavali Fund, and Secretary Nisha Ben. Nehal, President Talaksi Bhai, Advocate Talaksi Bhai, to come on the stage for the group photo. Thank you all.
Akro, I noticed kya hai? See, since we are sharing the stage, वो संस्था मले नहीं जो को वर्क करे रही हुई अनमें स्पेशली आया स्टेज में न रोंदा कि जो को मेडिकल फील्ड भी which was dominated by all women's. That's a woman power. Let's have a round of applause for women. અને ખાસ બહુ સંસ્થા સાથે કામ કરી રહી है પણ अनमें जो को मातुश्री मणिबेन शिवजी देवजी कन्या केवली फंड है जो को वुमन एम्पावर ला करने जो को चालू क्या हुआ अनि जो को ड्रीम भी जो को तो फाउंडर्स जी दैट ड्रीम सीम्स टू बी सक्सेसफुल कि भाई आज समाज में आटले लेवल ते छोकरी के मथे खड़े होने था. थैंक यू.